Actually, hospitality sector is also one of the areas which has been affected by the current fluctuations. The recent COVID-19 pandemic has affected the whole world. This epidemic, which affects the social and economic structure of the countries, also affects the tourism and hospitality sector. Destination image and perception of the security are most important reasons why tourists choose a country. The coronavirus poses a threat to countries. It is thought that it may lead to some change in image and perception of security as destination. So in this regards, actually, Professor Dr. Halil Demirer, he's participating from Germany, will explain how the COVID-19 affected tourism and hospitality sector in the small and medium enterprises. Thank you very much, Professor. We're listening to you. The mic is yours.
Hello, can you hear me?
Yes, sir, we can hear you, yes.
Okay.
And we can see the presentation as well.
Thank you, Dr. Demir. My presentation is going to be over COVID-19's effects on tourism shortly, and a research proposal. I have a research proposal, research that is not completed yet. We don't have data, but I'd like to introduce you with the proposal because it's important. First of all, I'd like to share some facts from the statistics of United Nations World Tourism Organization, reported in December 2020, that the international tourist arrivals dropped radically all over the world, mostly in Asia, the Pacific region, where there are many touristic destinations, valuable touristic destinations, which many people travel from all over the world. These numbers in red show that radical falls in tourist arrivals are the waves that will have consequences on economies, on small and medium size businesses as well. We have listened as participants in this very nice gathering. We have listened COVID-19's consequences from economics and business points of view. And we should admit that this indicator, tourist arrivals, is the wave that will have many other economic consequences. In the first hand, the decreases in the international travels resulted in less air travel and less hotel bookings, and negative impacts on stock values of tourism firms in the tourism chain, such as aviation firms, airports, cruise ships, car rentals, hotels, gaming, and entertainment firms, food and beverage service firms. Shortly, the whole economy in the world. Company sales and merging in tourism industry is another consequence in the first hand. And people should expect other bankruptcy news and merging news in the market. And tourism investment decreased eventually, actually. So the most important thing concerning people are the job losses in tourism industry. Tourism industry is a crucial industry, employing many people in the world. And in this industry, jobs cannot be substituted by new tech jobs. During the pandemic, we observed that as people in the world, something can be substituted, can be replaced by new techs. Some jobs could be performed at home, but not the jobs in tourism. Not really. This is the characteristics of jobs in tourism industry. That means employees in tourism industry who are jobless now, they don't have income. If they are not subsidized by governments, they are in a bad situation. There are barriers on the recovery of international tourism. Before coming to this gathering, I have searched for the webinars in YouTube about the consequences of COVID-19. Many institutions, many participants in many gatherings admitted that, agreed on that tourism business is seeking for short recovery, the ways to have a speedy and short recovery. But unfortunately, it is not possible because there are travel restrictions of governments. Before governments admitting that the pandemic is over, none of the companies in tourism sector in this industry can open the doors. Nothing can start, and virus containment is very slow. There are vaccination solutions and others, and social distance measures, but in the end, slow virus containment is an obstacle on the new start in tourism. And consumers have low confidence and they don't want to travel. Consumers in tourism industry are people. They have a psychology. They work in companies, and with the income, they make holidays. They are at the same time consumer and employees. Before having confidence in travel, they will not. So we have to wait. And another obstacle is slow flight resumption. Airliners and airports are depending on the government policies as well. They don't have travelers, they don't have bookings yet, and they have to be patient as well. As Dr. Zaim said, we have to be patient. As others agreed in internet, in YouTube gatherings, everyone agreed on being patient. But how? There's a new concept called active patient. Active patient is a concept invented by a thinker or by a contemporary thinker in our century. Active patience means being ready and stopping not. As far as firms and employees concerned and tourists concerned, how people can be patient without stopping, without stopping and doing something. It is possible. I have a research proposal on this, that firms should be ready for the new normal, not for the old normal. One day we'll have normal times, sure. But until that day, we have to do something as companies, as employees, to be prepared for the new normal. So we have something to be controlled, like our connection with the customers as firms, as far as firms concerned. For the first actions we do is to decrease internal costs and having governmental subsidies, but these are not the recovery solutions. These are something panic actions, as Mr. Zaim stated. We must focus on long-term actions. What are they? They are to invent new products congruent with pandemic measures. How? In tourism, finding new products and new concepts is not that easy. I mean, people should be with people in tourism. So pandemic measures do not allow this. And some products should be designed for social distance and with more hygiene conditions. For example, in sightseeing, lodging, and food beverage services environments, firms and governments and policymakers should try to find new concepts congruent with pandemic measures, congruent with these social distance and hygiene conditions. In the patients period, active patients period, in tourism firms should invent some new activities, tourism activities with smaller groups, such as health tourism products for families only, which are suitable from the social distance point of view. And policymakers should avoid international travels and individuals as well. They must focus on domestic travels and regulate them once again. And if possible, governments should subsidize as a measure in pandemic times. And firms should avoid mass, urban, and all-inclusive tourism. These are the concepts in tourism in old normal. But in the new normal, for a long time, tourism industry will not see the same business environment suitable for mass, urban, and all-inclusive tourism. These are the tourism concepts from which the majority of tourism income come from. And firms may try other concepts such as rural tourism, villa tourism, wildlife tourism, and other new things. Not to stop, to be patient, but actively patient. Government guidance in regaining market confidence and government guidance in regaining market confidence and destination image recovery. Governments are the institutions, powerful institutions that could keep the connection with the tourists, with tourist profiles, having a destination image. Keeping a destination image well in the minds of tourists will help a lot in the new normal of the industry. One day, when everything is over, when the pandemic is over, people will decide to travel, and destination image will affect their decision. There are many fields of, many streams of, many types of pandemic-related researchers in the field, but they may be grouped under 4 categories. The first category is a stream in which pandemic-related perceived risks, threats, vulnerability of tourists and their safety feelings and their efficacy beliefs and their revisit decisions are all examined from marketing point of view. And in the second stream, there are researchers examining the impacts of pandemic on tourist destination image. In the third group, there are studies in which pandemic communication or crisis management is being held, and information resources of tourists and residents are examined. In the last group, in the last stream of research in tourism, there are residents' perceptions of impacts researches. In my research proposal, I adopted the first group of studies, some part of first group of studies. In my study, pandemic-related risk perceptions are examined, and their effects on the service quality and tourist loyalty relationship. Service quality affects tourist loyalty to the destination, to the hotel, to the airliner, whatever. This is the fact. There are many research findings, empirical findings supporting this fact. But in the pandemic environment, risks perceptions should vary, may vary, and this should be investigated. In this study, there were 2 questions, research questions. Service quality effect on tourist loyalty should be checked once again, and then the subjective risk perceptions of tourists effect on service quality's effect on tourist loyalty is examined. A research model, consumption model, is illustrated in this figure. As you have seen, service quality has its subdimensions and tourist loyalty as well. And pandemic-related risk perceptions are the concepts found in the previous studies executed in SARS virus pandemic times and previous pig virus and other virus pandemic times. They are called health risk, travel risk, and perceived protection. These are the perceptions of human beings that may have an influence on the relationship, on the so-called relationship between these 2 research variables. Let me introduce shortly with the research concepts. Service quality is defined as the gap between consumer tourist expectation and actual service performance. There's a scale called SERPERF with 5 dimensions. We will use this scale in our research. Loyalty is defined as the degree to which a tourist exhibits repeat purchasing behavior from a service provider and possesses a positive attitudinal disposition toward the provider and considers using only this provider when a need for this service arises. We have used a hybrid scale, a hybrid tool to measure tourist loyalty. Perceived health risk is the assessment of travel-related health hazards, occurrence, likelihood at a destination, or in the way to a destination within a specific period of time. There's another hybrid scale adapted to measure this variable. Perceived travel risk is the risk a traveler's perceptions about the uncertainty and severity of negative consequences of pandemic. This scale is adapted from the medicine literature. Perceived susceptibility to illness implies the probability that a tourist may be negatively impacted by a health-related crisis such as COVID-19 pandemics while traveling. And perceived severity, as the last dimension, is the perceived magnitude of a health-related crisis. How people perceive how big the COVID-19 pandemic is. In this research, we considered population of the research are the leisure hotel guests in Germany and Turkey. And we propose that in a path model, we have 11 latent and 70 observable variables in our research. We had made a calculation called a priori sample size calculation for structural equation modeling. And we have seen that 262 participants will be enough for our research. The effect size is 0.1, statistical power requested is 0.8, and probability level is 0.05. People may experience this calculation in SOPER's website. Participants in our sample are will be arbitrarily chosen from the populations on a voluntary basis. Primary research data will be gathered from tourists using an interview-assisted Likert-style questionnaire. The research data will be in reflective nature and will produce continuous values. And data will be checked for missing values, outliers in analysis plan. We consider making multicollinearity analysis and then examining our scales, our questionnaire with exploratory and confirmatory factor analysis, and then testing our hypotheses in a path analysis. We have some expected findings in this research. We wonder if there are significant changes in the relationship between tourist service quality perceptions and loyalty due to perceived health risk, perceived susceptibility, and perceived severity. In case of a moderate or high level of mediation role of pandemic-related risks perceptions, such as these three, are found, the details of the findings about the sub-dimensions of research variables will guide managers and other practitioners for possible manipulations in service quality side. That means they will actively be patient. What to do on the service quality side? This is what we can control for the moment as business managers, as employees. The pandemic-related perception with a mediating role could direct managers and authorities post-pandemic communication with customers as well. Prospective findings of this research may show that service quality and tourist loyalty relationship is fragile to pandemic-related perceptions. That is what we needed, what we expect to find. And this may be the start of a new and exciting research design stream in the field. The findings with mediation effects could be retested with various service quality attributes and tourist profiles in different service settings in different countries and others. Further interpretations about the mediation role of pandemic-related perceptions could be made in this research regarding their comparative effects on loyalty subdimensions. Further research could also be designed to detect hotel profiles effects. That means there are many hotel concepts in the world in this relationship. Because hotels have a large span of services from all-inclusive tours to super luxury holiday packages. And we expect to give a start for a future research series in finding pandemic risk resistant service quality aspects. If we can succeed, this will be a good job in being actively patient. Thank you for listening. Sorry that was a research not completed in a proposal stage yet.
Thank you very much, dear Professor.
Thank you, Dr. Demirer. Can I expect some any questions?
Of course, there are the questions. Let me check some. It says that how do you measure the pandemic in a Likert scale? I mean, do you measure the pandemic situation in the Likert scale? If you do, then how?
Likert scales are the
Yes.
scales used in this, used in this research.
Yeah, do you measure the pandemic in the Likert scale?
Yeah.
Mm-hmm.
Likert scales are the scales that can measure reflective thoughts of human beings. I mean, their predispositional behavior, as indicated by Eagle, the founder of attitude theory. That which means shortly, you can, as a scientist, you can measure the thoughts of people in two ways: normative ways, reflective ways. In normative way, I mean non-Likert style, you can measure the real state, the present state, not the future. But with reflective scales, people can measure people's thoughts, people's dispositions, people's possible reactions in the future. That means this is a tool for predicting human behavior, estimating how will they behave. So I prefer to use reflective scales, Likert scales, to measure people's perceptions about health risk, travel risk, perceived susceptibility and severity in the face of pandemic. The data gathered by using these reflective Likert scales will be used in structural equation modeling for testing mediating role, as I have previously illustrated in the model. As you can see,
yes,
all these Likert scale values, the data will be used as will be tested for mediating effects in the relationship between these two main variables.
Yeah. Dear Professor, may I ask you one thing about the model that you have developed? Are you thinking to co-work with someone? Because here we have the academicians who are, coming from different countries. More than 30 countries participators are here. So that, yes. Are you thinking to share your research with them, maybe co-working with them, co-authoring with them? Do you have such plans?
Of course, in the first hand, I expect to have some support from German institutions to finance this research, because we need some people to execute field studies. But these kinds of studies, this is not a unique study. This is something should be done. I have observed that in the literature, not yet done, so I prefer to do, so I can share it with others to enlarge the sample size, the countries, the number of countries can be increased in the research, the number of participants, that means the more tourist profiles could be added into the study by the help of other participants. Let's say people from famous destinations from the Far East, Indonesia, Malaysia, Taiwan, Cambodia, and others from Phuket, for example, one of the most famous destinations, may participate in the study to enlarge the sample size and to make more insightful comparisons between countries and cultures. In the end, we can see that these destinations are responded differently to the pandemics. For example, the profile of employee and the strategy adopted by the government there in, let's say, Malaysia, can be very different than Turkey, for example. And this will affect our study, the results and findings as well. The style of communication in crisis times by governments, firms, are very important in determining, are very important and are very effective on prospective tourists' mind. That means
Yes.
Tourists who are expected to decide where to travel.
True. True. Yes, Professor.